Hello everyone, welcome back to my channel, that is Obstetrics and Gynecology Simplified. Today we will discuss about the fetal skull. Okay, so this is a very important topic for the practical exams, and in practical point of view we have to know the different sutures, fontanelles, and the presenting parts of the fetal skull, the diameters, the anterior posterior diameter as well as the transverse diameter. Everything we have to remember it. Okay, so what are the bones, sutures and fontanelles on the fetal skull? See, so this is the front, this is the back, this is the superior, and this is the inferior surface. So here, what are the bones? Here is the frontal bones. Okay, and this one is the frontal eminence. Okay, these are the frontal bones, and this is the frontal eminence. Here, posteriorly, that is the parietal bones. Okay, and here are the parietal eminence. Okay, these are the parietal bones, and this is the parietal eminence here and here. Then this one is the occipital bone, and this is the occipital protuberance. So this is the occipital bone, and this is the occipital protuberance. And what are the sutures? Anteriorly, there is frontal suture. Okay, then here is the anterior fontanelle, here is the posterior fontanelle, and here is the anterior coronal suture, and here that is the brachmatic. Okay, then this one is the midline sagittal suture. Okay, so in the vertical part, this is the sagittal suture. So understood. So what are the sutures? The sagittal or longitudinal suture. So these are the parietal bones. So here the there is the sagittal suture between the two parietal bones. Here are the parietal eminences. Then coronal sutures, that is it runs between the parietal bone and the frontal bone on the either side. So this is the coronal suture. The frontal suture, this is the frontal suture, it lies between the frontal bones. And the lambdoid sutures, this one is the lambdoid suture, and it lies between the parietal bone and the occipital bone. Okay, so what are the importance? These sutures, these are of the obstetric importance because these allow the gliding movements of one bone over the other. It helps in molding, and it causes small variation in shape so that the fetal head is negotiable through the maternal pelvis. Okay, and also in addition to the digital palpation of the sagittal suture during the labor, okay, it gives important information regarding the internal rotation of the head and the manner of engagement as well as the syncretism. Okay, syncretism and asyncretism can be known by palpating the sagittal suture. And what is the importance of fontanelles? There are two fontanelles here, the anterior and posterior fontanelle, but overall it has 6 fontanelles, out of which only 2 are of obstetric importance. Okay, so anterior and posterior are of obstetric importance, and the anterior fontanelle it is called as bregma, and the posterior fontanelle it is called as lambda. Okay, so anterior fontanelle it is formed by, see, it is formed by joining of 4 bones. So here anteriorly there is present of frontal bones, posteriorly there is presence of parietal bones, and on either side there is coronal sutures and sagittal sutures. So anterior, posterior and transverse diameter are approximately 3 centimeter each. Okay, this one is 3 centimeter, this one is also 3 centimeter. And the floor it is formed by the membrane, thin membrane, and it becomes ossified at 18 months after birth. It becomes pathological if it fails to ossify even after 24 months. Okay, then coming to the posterior fontanelle. In posterior fontanelle, it is formed by junction of the 3 suture line. First, the sagittal suture anteriorly and the lambdoid suture one on each side. This one is one lambdoid suture, this one is another lambdoid suture. Okay, so by joining of the three suture line, the lambdoid posterior fontanelle is formed. Okay, and this one is triangular shape. Okay, this one is triangular shape, and it is about 1.2 to into 1.2 centimeter, and posterior fontanelle it ossifies within 2 to 3 months of birth. And the floor of the posterior fontanelle it is covered by a membrane. So ossification of the posterior fontanelle is intramembranous ossification. Then coming to the sagittal fontanelle, it is inconsistent in its presence and no clinical significance. Okay, and also what are the presenting parts of the skull? Coming to the presenting parts of the skull, there is vertex, brow, face, and other parts of the fetal skull which are like significant is inciput, occiput, mentum, the parietal eminences I've told you, and the subocciput and submentum. Okay, so we will define and we will see this each part. Okay, so what is vertex? First you should know what is vertex, where it is present. What is the definition? It is a quadrangular area. Okay, it is a quadrangular area which is bounded anteriorly by the anterior fontanelle and coronal sutures. So this is the coronal sutures, this is the anterior fontanelle, and posteriorly by the lambdoid by the lambda posterior fontanelle and lambdoid sutures laterally. Okay, so this is the vertex. So when the vertex is the presenting part, that means fetus is in complete flexion. So this is the presenting part, that means the fetus is in complete flexion. If this is the pelvic floor, that means if the baby's head is coming down, and if the vertex is the present, we will see the we will see the vertex by doing the PV examination. So here that means the fetal head is completely flexed. Okay, then that vertex is the presenting part. Then coming to the brow, so this is the area that is bounded on one side by the root of the nose. Okay, by the root of the nose. Then supraorbital ridges, this is the supraorbital ridge, and on the other side by the bregma and the bregma, that is the anterior fontanelle and the coronal sutures. So this part is the vertex, this part is the brow. Okay, then fetal head it lies midway between full flexion and full extension in this position. So this is in complete flexion, the presenting part is vertex. In deflexed head, okay, the presenting part is brow, and face is the presenting part in extension. So this is the face. So what are the boundaries of the face? This is the area which is bounded on one side by the root of the nose, okay, root of the nose, along with the supraorbital ridges on the both side, and coming to the junction of the chin or the floor of the mouth with the neck. And fetal head is fully extended during this presentation. Okay, so understood. When it is completely flexed, vertex, then partially deflexed, completely flexed vertex, deflexed is brow, and then extended means face presentation. Okay, then what are the other parts I've told you? Sinciput, it is the area in front of the anterior fontanelle corresponding to the forehead part, this is the sinciput, and occiput, that is limited to the occipital bone. Okay, and what is the mentum? Mentum is the chin of the fetus, and these are the prominent parietal eminences in the parietal bone, and this is the subocciput that is present just at the junction of the fetal neck and the occiput, that is just below the occipital protuberance is the subocciput, and submentum is just below the mentum here. Okay, understood. Then coming to the importance of the diameter. So what are the important diameters? First we should know, then we will know the importance of the diameters. So what are the diameters? First there is anterior posterior diameter and then transverse diameter. Okay, what are the important anterior posterior diameter of the fetal skull? When the presenting part is vertex, okay, that is completely flexed head. That means I've told you the presenting part is vertex, that means completely flexed. Okay, so the engaging diameter is suboccipito-brachmatic diameter. Okay, so this is the suboccipito-brachmatic diameter. Okay, this is the engaging part, that is 9.5 centimeter. Okay, then in partial extension or deflexed head, that is brow presentation. Okay, this part is the brow. So the brow, in the brow presentation, that is the mento-vertical. This is the longest diameter, that is mento-vertical diameter. Okay, this one is the longest diameter, that is 14 centimeter. And in face presentation, that is mento anterior position, submento brachmatic. Okay, submento pragmatic diameter, that is 9.5 centimeter. And in mento posterior position, that is submento vertical. Okay, that is slightly more, that is 11.5 centimeter. Okay, then what are the transverse diameter? Transverse diameter, first is the biparietal diameter. Okay, biparietal diameter, that is 9.5 centimeter. Then superior subparietal diameter, that means a point below one parietal bone to the point above one parietal bone. Okay, here if we're taking below, then here we will take above the parietal eminence. Okay, that is 8.5 centimeter. And bitemporal diameter, okay, this is the bitemporal diameter. Okay, that is 8 centimeter. And then this is the semestral process is not visible here. So here that is bimastoid diameter, that is 7.5, and this is the shortest, that is the between the tip of the mastoid process, and this diameter is nearly incompressible. So this is the smallest diameter of the fetal skull. Okay, then so we have to remember, a mnemonic is small mnemonic is there, that is Miss Tina is so pretty. So M for bimastoid diameter, that is the smallest, then bitemporal. Okay, and then for super subparietal diameter, that is 8.5 centimeter. Then P for biparietal diameter, that is 9.5 centimeter, that is the largest. Okay, so Miss Tina is so pretty. M for bimastoid, T bitemporal, S super subparietal, P biparietal diameter. Okay, then we have to remember all the epidiameters and transverse diameter. The longest I've told you, that is the mento-vertical diameter. The images and a PowerPoint presentation showing all the images of the diameters I will be posting, and also that presentation I will be explaining in another video. If at all you cannot understand this, you can just go to that video and you can just learn about the diameters and the images, and then come back to this video for the detailed practical understanding. Thank you. Keep learning.